So we're going to talk about how to get rid of this little mommy tummy going on and how to check to see if it's truly diastasis. If you don't know me, my name's Olivia Cagle, and I'm a prenatal, postnatal, corrective exercise specialist that helps mommies get fit from the inside out, spiritually, physically, and emotionally. And I'm also a diastasis restoration specialist. So, anyway, how many of you, let me see, do you know what diastasis is? Or do you know if you even have it, or are you confused about what it is? I'm hoping that when I lay down, I'm going to demonstrate this. I'm trying to get, I don't have a holder for my iPad, so I'm trying to get it just right so you can see me. Okay, so let me kind of show you how to check for it, okay? So you lay down. No, you don't know what it is, or have you wondered? If you can't get rid of, okay, yes. Yes, Dee, yes, you have it, and I know we've talked about it, but if, let's say you've been pregnant and nothing is going the same with your belly, you can lose everything else, but that belly, it just won't, you can't get rid of it. A lot of times it could be diastasis, doesn't necessarily mean it is. It could be digestion and bloating issues. It could be stress. But let me show you how to truly check if you have this or not. So, oh, thank you, baby. So, let me lay down. Hopefully you can see me. So what you want to do is you want to lay down, okay? And I just want you, I'm going to have to show you my head first. Just barely lift your head up. I don't want you coming up in a crunch, okay? So you just barely lift your head up. Okay, and so where your ribs meet, so barely lift your head up and keep your head up, okay? And I want you to start pushing with your finger right here. You don't have to push real hard, but just feel, most of the time, unless your diastasis has come all the way up here, it is pretty thick right here, okay? So come down like this and start feeling where maybe there might be a separation going on, okay? So this way you can figure out the length of it, okay? So you would do this and then keep going down. And a lot of times people, or the women, it's going to be deeper here at the belly button, but that's not always the case, okay? So you're going to come here. And then whenever it starts to separate, and keep your head up, you want to see how many fingers wide you can fit in it, okay? So that's what you do, right here. And then to see, here, the depth is the most important. So you want to see how far your finger goes in. So you want to check at your belly button. You want to check about 2 fingers up. You want to check here, and you want to check about 2 fingers below for the width and the depth. So sometimes the depth, if it can come here, it can come to your first knuckle, it can even come up here. Some women might be 4 fingers wide, some women might be 3 fingers wide, okay? So that's kind of how you check to see, you know, so if anybody says, how many fingers wide are you? What's the depth? That's the best way I have found to figure it out for my clients, okay? Sometimes there's the connective tissue here is the linea alba, and it starts separating and stretching, and it separates these muscles right here. And it can become real thin, kind of like cellophane. So when you feel this, you kind of want it to feel more like the cartilage of your nose and not your cheek. But the deeper your finger goes in, okay, the deeper your finger goes in, the thinner that has stretched out, okay? So that, hey Christine, so that's how you need to check. So you want to check the length as well as the width, as well as the depth. The depth is the most important. So a lot of women heal up differently. One of the frequently asked questions I get is, how long does it take to heal? There's not one answer for everybody. Some women's depth will heal first and then the width, and some women's width will heal faster than the depth, okay? So some symptoms of diastasis would be, you just feel like you have a weak core, okay? Or maybe your lower back hurts a lot. A lot of my clients, one of the things that they notice after they start their homework and everything is their lower back gets stronger and it doesn't hurt as bad. That's one of the things they do notice. You may have leakage. You could have a hernia. Those are just some symptoms that kind of go along with diastasis. It doesn't necessarily mean that you will have that. But that I just wanted to show you real quick because a lot of women don't know if they have it. Some women will tell you, some people will tell you, if your diastasis is 2 fingers, that can be normal. Or you may not have a diastasis. Some are 1 finger. Each woman is different on what their width is going to be, but you need to pay attention to the other symptoms that you have. And the other one, of course, is a pooch. And if you crunch up and it comes in a dome, or if you're in a plank and it's like a dome shape, okay? So you need to work on getting this core strong. You want to strengthen your transverse abdominal that runs like this. It's your God-given corset. And you also want to strengthen your pelvic floor muscles as well as your diaphragm. You want to get all those working together and fix your alignment and breathing. That is what will take care of your diastasis. Now,